This is a story about a 15 years old girl. This is a story about me and how I've overcome different challenges that once thought will consume my life. A 15 years old girl who graduated quite early. I was only 15 when I completed my high school, very eager to win the world. I was enthusiastic. I was a go-getter. But behind this ambitious, ferocious girl, there was a girl who had absolutely no idea what was going on with her body. Her face was full of acne, facial hair, unexplained weight loss, mood swings, hormonal turbulence. I remember getting my periods only 3 days before my 12th grade exam. I told my mom about the irregular period and the difficulties I was having, and that's when she took me to a gynec. And as usual, the gynec requested for some of the tests and investigations. I remember being in the radiologist's office and I was in the bed. When the probe was going up and down on my lower abdomen, the doctor looks up to me and says, "I'm so sorry you were going through this." My heart sank. I had absolutely no idea what was going on with me. Then he looked up to my mom and said, "This is probably something she will face throughout her life, the insulin resistance, facial hair, unexplained weight loss or weight gain, and most important of all, she will probably have difficulty conceiving." A 15-year-old who had absolutely I felt broken inside because that one last line felt like a life sentence. But you know, they say life has amazing ways of revealing its purpose. Fast forward to 2013, after I graduated my university, I started working for a fertility clinic. And it was there, between the petri dishes and under the microscope, I finally began healing. Not biologically, but scientifically and emotionally. For the first time in my life, I learned that infertility or subfertility is not a curse. It was not the reflection of who I was, but it was a reflection of biology, medicine, and sometimes circumstances. And today, after 12 years of working as a clinical embryologist, thousands of couples I've met who've come to me, visit to me, they're suffering, they're carrying the same emotional burden that once I carried. Fear, confusion, shame, and hope. They come to me from different countries, cities, localities, social background, and yet they all carry the same common universal pain, the longing to have a kid, to have a child, to hold their own. And there is one truth that we must acknowledge, that infertility does not discriminate. It doesn't matter what religion you belong to, which social background you come from, or what gender you belong to. WHO has stated that 1 in every 6 individuals undergoes infertility sometime in their life. This accounts for about 17.5% of world population. And this is not a small number because I'm talking about 186 million individuals globally who are battling, was struggling with infertility in silence. And yet, this is one of the under-discussed, underfunded, and under-supported global health crisis. And when I talk about infertility, some of us, we quickly think about women. But let me break this misconception. Men and female, we are equally responsible for the infertility. 30% of infertility issues, they come from male fertility, from males. 30 come from female. 30, both partners combined, and 10% remains unexplained. Infertility, especially from females, usually accounts for ovulation disorders, exactly like what I have, polycystic ovarian syndrome, endometriosis, blocked fallopian tubes, diminished ovarian reserves, hormonal imbalances, fibroids, adenomyosis, and whatnot. For men, it accounts and stems from lower sperm count, diminished sperm motility and morphology, DNA fragmentation, varicocele, hydrocele, trauma in your genitalia during childhood, measles, mumps, high fever, again, hormonal imbalances, or even your life choices. And here's one very interesting revelation, that infertility in today's day is not just about biology, it's also about your lifestyle. These silent lifestyle choices that you're making every day actually is impacting the bigger and the larger part of your health, which is the reproductive system. You'd be surprised to know that now the first birth age for the average woman now has grown up to 30, which is almost a decade later than what it was in 1900s. In 1900s, the female would opt for having a baby in their 20s, which has now grown up to 30. And at the same time, the registry of 2024 data, it also accounts that most of the women are not even choosing to have kid, and which is okay, there's nothing wrong with that. What we need to understand is a female fertility declines after 30, and there is a steep drop after 35. And same stands for men as well, because their fertility starts declining from the age 40. Infertility is just not a biology or a lifestyle, it just not impacts the lifestyle, but it's also an emotional journey. I have seen couples who struggle emotionally, who struggle with relationships. I've seen their self-respect being dismantled, the relationships being affected, couples who have avoided social gatherings, who have avoided the conversation around children and pregnancy. They have avoided meeting friends who have recently conceived or had a baby. But what we need to understand, it doesn't make us less of a human. It does not make us less of a woman, or it does not make us less of a man. We need to destigmatize infertility because it's not a taboo. It's just a medical condition which is manageable and often treatable. Now, when it comes to treating infertility or managing infertility, we need to talk about assisted reproductive technologies. In modern reproductive medicine, which is more accessible, more affordable, and more patient-centric as well. Because in the last few decades, it was portrayed as something which was very physically painful, emotionally draining, and also exhausting for most patients. But now that narrative is slowly changing. Now there are so many IVF clinics opening up, there are fertility clinics, there are booths and support groups where you can go and talk openly about your reproductive health issues. Technologies such as IVF, blastocyst transfer, where you grow an embryo outside the womb for more than 5 days. You have pre-implantation genetic testing, where if you run with any kind of genetic condition in your family, now that can be picked and taken out of your system, and you can have a healthy offspring. You have an option of vitrifying, that is freezing your fertility, eggs or sperm, so that you have a better reproductive option in the future. Our generation live longer, but we decide to reproduce later. And trust me, there is nothing wrong with that. Fertility awareness is not about pushing parenthood on your faces. It's about making that informed decision so that we know our body better. We know what needs to be done in order to preserve our fertility. And as the technology is advancing, we as a society, we also need to catch up. We have to make it a conversation in classrooms, not just between a doctor and patients. We have to talk about it with our in-laws, with our family members, with the teen boys and girls we have in our family. Imagine we teach about fertility education along with the reproductive system and sex ed to the younger generation. They can raise the alarms whenever they are having reproductive disorders, or they know the impact of their lifestyle, of their poor diet or sleep cycle disturbances, the impact of trauma, all of these, and how it's going to impact their fertility in future. We will be raising a generation who is informed and not scared of their biological clock. I remember one of my friends who was well in her 30s, she came to me and she proudly flaunted, saying, "My mom conceived me in her 40s. All my siblings, they have absolutely no problem having babies. So me, I'm gonna take 4 or 5 more years finding a suitor and planning for pregnancy." Jokingly, I challenged her saying that, "Why don't you get your fertility tested?" Unfortunately, I came to know before her that she was suffering from something called premature ovarian failure, in which her viable eggs that were reproducible were over even before she was 30. And now she had a very, very slim chance of having her biological child. And this realization that biology does not wait for convenience changed her perspective and changed many other people's perspective who were associated with her. And this is the truth that we are facing, especially in cities, especially with the career women and men. Today, I stand in front of you as someone who has frozen her egg twice. I'm 34. I'm not married. I don't have a child, but I can proudly say that I've had my reproductive options ensured. I can choose when to have a baby, well before 40s, but I know my baby is going to be healthy. She or he, whoever decides to be my offspring, is going to also experience the same reproductive freedom that I have. So today I urge you, whoever is listening to me, that I wish I could go back in time and talk to my 15-year-old self, telling her that no, you're not broken. You're just uninformed. The stories, the repercussions were not discussed to you properly. There was no safe space for you to talk about what was going on with you. And today, whoever is listening to me, man or woman, whether or not you're a parent, reproductive health belongs to all of us. Let's not wait for a diagnosis to make us curious about our bodies. And let's not wait for a heartbreak to be kinder. Thank you very much.